Hi, I'm Marcus J. Motomo, nursing student of Jose Rizal Memorial State University main campus. And today, I will be performing the assessment of the neurologic, musculoskeletal, and peripheral vascular system. And prior to the assessment, I will perform first the hand hygiene. Hi, I'm Marcus J. Motomo. I will be your student nurse for today. And before we start the assessment, may I ask your name first? What's your name, ma'am?
Christine Malacat,
Your age?
22,
And then your date of birth.
March 8, 1999.
Now, I will close the curtains for your privacy, ma'am, and I will be assessing the neurologic, musculoskeletal, and peripheral vascular system to check if there is abnormalities. That would be okay, ma'am. First, I will close the curtain. And do you have any questions or clarification regarding to the assessment, ma'am?
No.
And don't worry, all the findings are confidential. First thing to do is I'm going to help my patient to undress if needed and to position my patient supine. Okay. Okay, are you comfortable right now, ma'am? Okay, that's good. Now, assess the patient's mental status and please answer my questions, ma'am, honestly. And where are we right now, ma'am?
Center,
What time is it?
9:30.
Do you feel pain right now?
No.
Okay. Okay, this will help the patient to identify level of awareness. And now, what is your explanation, ma'am, about the proverb, the early bird catches the worm?
I don't have any.
Okay. Next is I'm going to test the cranial nerve function. And please close your eyes, ma'am, and I will occlude your left nostril. What have you smell, ma'am?
Lotion.
Okay. Tell me what you smelled and I will occlude your right nostril. What have you smelled, ma'am?
Perfume.
Okay, good. Then, test the visual acuity and pupillary contraction. First, it is to test the visual acuity. I will cover your left eye, ma'am, and all you need to do is to read what's on the chart. Okay, kindly read, ma'am.
FAMILYPLANNING CORNER.
Okay, then let's do it on the other side. I will cover your right eye and kindly read what's on the chart, ma'am.
FAMILYPLANNING
Okay, good. Okay, and now let's proceed to the pupillary construction. All you need to do, ma'am, is to follow the object. I will put this here on your nose. Okay?
Nasubrahan ako.
Okay, good. Next is to move the patient's eye through the 6 cardinal position of gaze. And I want you, ma'am, to focus my finger. Okay?
Pero ang imugang pang-amoy yung panglasa.
Okay, good. Can you please smile for me, ma'am? Front, wrinkle head, forehead rather. Then,
Sa Monday ba? Na nakaiba?
pop out your cheeks.
Sa Monday.
Like this. Okay, good. Next is to test my patient's hearing. I will cover your left ear, ma'am, and I'm going to whisper you and tell me what you hear. Okay?
Beautiful.
And let's do it on the other side.
Pretty.
Okay, good. Next is to test gag reflex by touching the posterior pharynx with a tongue depressor, and this might be uncomfortable, ma'am. Okay, kindly open your mouth. Okay, good. And then I will shrug your shoulders. Do it like this now. Okay. And then I will put my hands on your left and right cheeks. And all you need to do is to push it, ma'am, like this. Okay? Let's do it, ma'am. Okay, good. Now, inspect the ability of the patient to move her neck. Okay, can you move your head side to side, ma'am? Like this. And touch your ears on your shoulders. Then touch your chin on your chest. And lastly, kindly look up and ceiling. Okay, good. Now I'm going to inspect upper extremities. Observe for skin color, presence of lesions, rashes, or muscle masses. Okay, can I have your hand now? Okay, your skin color is light brown and there is no presence of lesions, rashes, and also there is no muscle masses. Then I'm going to palpate and inspect your skin for temperature and for the texture. In checking the temperature, I'll be using back my hand because it is more sensitive for temperature, okay? Okay, your skin is warm and it is smooth and also it has a good amount of moisture. Next, I'm going to ask my patient to extend her arms and turn the hand up and down. And can you do like this, ma'am? Extend your arms up, down. Okay. Good. Next, I'm going to hold the hand of my patient. Okay. Kindly push me, ma'am. Okay. Good. This technique assesses the muscle strength of the upper extremities. Now, inspect and palpate the hands, finger, wrist, and elbow joint. Okay, there is no presence of lesions, ma'am, and also there is no abnormalities. This inspection and palpation provides information about abnormalities, tenderness, and range of motion. Now palpate the radial and brachial pulses.
Obserbahin mo gawas, ha? Obserbahin na.
Okay. Pulse palpation evaluates the peripheral muscular status of the upper extremity. Now, kindly squeeze my finger, ma'am. And now I'm going to ask my patient to cover her eyes and telling me what she sees. Okay, can you cover your right eye, ma'am? And I will cover my left eye too. And please tell me what number did you see, okay?
2, 3.
Okay, let's do it on the other side. Please cover your left eye and I will cover my right eye. Then tell me what number did you see, okay?
4, 1.
Okay, good. And now kindly close your eyes, ma'am. Okay, I'm going to write anything on your palm and all you need to do is tell me what is it, okay?
Okay. 1.
Then let's do it on the other hand.
2.
Okay, now test for pitting edema in the peripheral area by pressing finger into the skin of the peripheral area. If an indentation remain in the skin after the finger have been lifted, pitting edema is present. Okay, there is no edema being present. And now palpate for pulses and skin temperature at the posterior tibial. This is located behind the knees and I'm going to palpate and rate it, okay?
Naman, saan sila nag-start?
Okay, there is 2 plasma, which means normal, and let's do it on the other side.
Aman yung Wednesday.
Okay, there are also 2 plus, means normal.
Wala man.
Now let's perform the straight leg test with 1 leg at a time. Okay, kindly raise your legs, ma'am. 1 leg. Then also to the other leg. Okay. This test check for vertebral disc problems. Can you move your 1 leg laterally with the knee straight to test abduction and medially to test abduction of the hips, okay? Now kindly please raise your thigh against the resistance of my hand, okay? Okay? Push outward against the resistance of my hand. Outward now. Okay, then pull backward against the resistance of my hand. Okay, and then repeat on the other side. Okay. Okay. Okay, good, ma'am. Now, assess the patient's deep tendon reflexes. Since I don't have the reflex hammer, I will just be stating the steps and also the rationale. Okay, I will place my finger above the patient's wrist and tap with a reflex hammer. And then do it on the other side. Next, I will place my finger at the elbow area with the thumb over the antecubital area and tap with a reflex hammer. And repeat on the other side. I will place my finger on the triceps tendon area, tap with a reflex hammer, and repeat to the other side. Next, tap just below the patella with reflex hammer, and then repeat to the other side. Lastly, tap over the Achilles tendon area with reflex hammer, and then repeat to the other side. Now, I will stroke the sole of my patient's foot with the end of a reflex hammer or any hard object available. Okay, can you please lay down, ma'am? Okay, and do it to the other side. Okay. Now, kindly do the dorsiflex and then the plantar flex both against the opposing resistance.
Wala dito sila sa dispensing. Pero naamla din sa COC.
Okay, now can you please stand? I'm going to observe how you walk with a regular gait on the toes and then on the heels. Then on the heels to two. Okay, good. And now let's perform the Romberg's test. Please stand straight, ma'am, and put your feet together, and your eyes are both closed with the arms at the side. Okay? Okay, I will wait 20 seconds to observe for your ability to maintain balance. Okay, good. And now I'm going to assist my patient to her comfortable position. Okay, and that's it. And now I'll be using a hand hygiene to prevent the spread of the microorganism. Okay, that's all, ma'am, and thank you for your cooperation.